See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Welcome to See You Now. I'm Shauna Butler. See You Now has always focused on the incredible stories of nurse-led health innovation. And we're pleased to continue with our newest series, Frontline Forces, documenting the pandemic response of frontline nurses to the overwhelming challenges and uncertainty and the changing nature of nursing in the midst of the evolving circumstances nurses are facing at this point in the pandemic. The historic delivery of COVID-19 vaccines was the result of an executive action officially announced on May 15, 2020, as Operation Warp Speed, a public-private partnership initiated and coordinated by the United States government that aimed to facilitate and accelerate the development, manufacture, and distribution of safe and effective COVID-19 vaccine therapeutics and diagnostics. The aim of Operation Warp Speed was to begin delivery of 300 million doses of a safe, effective vaccine for COVID-19 by January 2021, 8 months from the date of that announcement. Rather than eliminating steps from traditional clinical trials and vaccine development timelines, protocols and processes were harmonized and overseen by the National Institutes for Health, so development and manufacture could proceed simultaneously, such as starting manufacturing of vaccines at industrial scale well before the demonstration of efficacy and safety, as happens normally. This increased the financial risk, but not the product risk. The delivery of commercial vaccines in less than a year is nothing short of miraculous. While other medical moonshots and breakthroughs have been achieved, few have occurred with the speed and success of developing the COVID-19 vaccines, and many medical problems remain elusive even with decades of work. So, December 14, 2020, just 7 months after announcing Operation Warp Speed, was the first day the COVID-19 vaccines were administered in the U.S. And those on the front lines of healthcare were among the first in this historic and unprecedented mass vaccination effort to receive them. Along with her colleagues from Northwell Health's Long Island Jewish Medical Center in Queens, New York, critical care nurse Sandra Lindsay unhesitatingly and voluntarily rolled up her sleeve and got her COVID shot in the company of dozens of her colleagues, hospital leadership, and cameras, not realizing or planning she'd become the first person in the U.S. to receive it. Within minutes, the now iconic images and video footage of her receiving a COVID-19 jab administered by a fellow nurse began circulating in media outlets around the globe. And along with it, a high-profile opportunity to reach others, inspire them, and build their vaccine confidence.
My name is Sandra Lindsay. I serve as the Director of Patient Care Services for the Division of Critical Care at Long Island Jewish Medical Center, Northwell Health. I grew up in Jamaica in a parish called Clarendon with my grandparents. My parents were always present, but my grandparents had more of the ways and means to take care of my siblings and I. And we also loved to go to our grandparents' home. And my grandmother was truly the matriarch of the family. She was a distinguished woman, an educator, well-respected community leader. She opened up her doors to everyone in the community. They would frequently come to her for counseling. If people didn't have dinner, they know they could come there. She had that fighting spirit, really calm. a lot of that rubbed off on me. I think I was able to draw on some of those experiences throughout my journey to adapt to the changing situations in my life. March 7th, 2020 is when we got our first COVID patient in the intensive care unit. We were so careful with that patient on isolation. We made sure it was a 1-to-1 nursing to patient ratio. Plus, we had a technician outside of the room just to help people to don their personal protective equipment and to make sure they're doffing properly and practicing hand hygiene because we didn't want it to spread. By the 16th, Monday morning, when I came back into the building, it was a different place. All the ICUs were all filled with COVID patients. All the rooms had isolation signs all over. The staff was head to toe in personal protective equipment. They had bouffant hats on, gowns, goggles, face shields, booties covering their shoes, and people were just running. And you could see the fear in people's eyes, glossy eyes, crying, not knowing what is going on. We just kept hearing over our speaker system, code blue, cardiac arrest, intubation, anesthesia stat, and people were just running to save lives. I was devastated. I felt helpless. I was afraid. I shared the same fear that people had in their eyes. I was terrified for myself, for my staff. I felt a huge sense of responsibility for their safety. There were so many questions that I didn't have answers to. COVID-19 had hit us like a ton of bricks. One of my biggest fears was that I would get sick. I would have to stay out and isolate and not being able to be here at work with my team. I remember one night we had to open yet another ICU because the volume just kept going up and up and up. And I remember walking up 6 flights of stairs to this unit where we were going to open up another ICU. One of my nurse managers and I got to the landing and I could not move my feet anymore. They were just stuck. And I leaned up against the wall. I was just shaking. And he said, "Sandra, you have to go home. You don't look good." And I said, "I can't go home. We have to open this unit." He goes, "We got this. You got to go home. You don't look good." And I said, "Dear God, please don't let me get COVID." And I went home, and for the first time in my life, I was afraid to close my eyes because I did not want to die alone. I remember drinking some tea and taking out my Jamaican white rum and rubbing up from head to toe. I was drenched in this because, you know, in my Jamaican culture, white rum fixes everything. You have a headache? Okay, just rub some white rum on your forehead. You'll be fine. You have back pain? Rub white rum. So we all have our little cultural things that we go back to. It felt like, you know, my grandmother was rubbing me down when I was sick and tucking me into bed. And maybe that's what I was hoping for at that time, you know, just a nice hug and a tuck in and to hear that it will be okay. And I said a prayer and I woke up the morning feeling refreshed. I took a shower and I went to work. I didn't have COVID. It was just extreme exhaustion. I was very, very fearful of getting sick, not being able to work, and that guilt that I would feel. On December 14th, 2020, this is the day that I was going to be able to get that shot of hope in my arm that would take away all the fears, all the heavy burden that I had on my shoulders, all the weight that I was carrying around. I would be able to get that shot that day. So when I entered the conference room where the vaccine was administered, I was getting vaccinated with other colleagues that day. I thought that I work for a large health system. They're going to want to document this. But I thought it would be, our health system photographer taking some pictures. So when I got there were a few people there, some cameras set up. I wasn't focused on that. I paid no attention to which camera or who was in the room. I was talking to the executive director of the hospital, the executive director of operations. I had no idea what was about to happen. Neither did they. They didn't know that it was going to be the first vaccine. We just know that we were going to document it for our health system and possibly the local Long Island news. When the shot went into my arm, I immediately felt a sigh of relief, hopeful, like a huge boulder rolled off of my shoulders. And I just started clapping. I was just so happy. I was saying goodbye after exchanging pleasantries, saying goodbye, I have to go back to work. And I remember the AED of operations said, "Sandra, where are you going?" And I said, "I have to go back to work." And he said, No, not so fast. We have a press conference at 11 and a press conference at 2. And I said, "What? A press conference? I've never been in a press conference before." I had nothing prepared. And here I was, propelled into the spotlight, a shy, if you can believe it, introverted young lady at a press conference with all these cameras and a podium. There was nothing prepared. And so I just spoke from the heart. Not getting vaccinated was never an option for me. I knew that it was the best way forward to get out of this pandemic and to protect myself. But I also understand that it's a sensitive topic and that people want the option to make their own decisions, and they don't necessarily want government to be telling them what to do. And I'm also sensitive to the fact that the vaccine became so politicized. So I tried to handle it in a sensitive way to show people that I care about you, and I do, to listen with the intent of hearing like their underlying fears and not to argue with people or shame or pass judgment. I held the hand of a 9-year-old who wrote to me. She said I was her hero. She wanted to know if I could administer the vaccine. And I could not, but I offered to hold her hand when her time came. And so I followed through on that promise. I was there to hold her hand. I didn't give much thought initially to me, a Black woman, being vaccinated by another Black woman, both nurses, both immigrants. But now that I look back, it sends powerful messages to women, I believe, to young people, to professionals, to immigrants. It sends a message of hope, of courage, with where I have gone since that day and the opportunities and the doors that have been opened for me. And it also sends a message to the Black and the brown community, people of color, that I think it's perhaps time to start mending the fences when it comes to trust in the medical community, that we need to start somewhere, and perhaps now is the time. We know it's not perfect, but together we can build the environment that we want and have a say in how we want to be cared for. I work for an organization that values diversity, inclusion in our workforce. Building a diverse workforce helps to build trust between our patients and our caregivers. We didn't go seeking to get a Black woman to take the first vaccine. But because we have such a diverse workforce, on that day where the vaccine was being administered, we had a diverse group of people getting vaccinated that day. As it turns out, I went first and became the first person in the United States. I think that was important for the community, the surrounding community. That helped to increase the trust in the community, in the workforce, to then want to get vaccinated. Since being propelled into the spotlight on December 14th in 2020, I've had the opportunity to be recognized at the White House by President Joe Biden, receiving the Americans by Choice recognition for my achievements and contributions as an immigrant. That was incredibly meaningful for me. When I reflect on that moment, I get emotional because there has been so much negativity around immigrants, and we are very much a part of the fabric of this great nation. So being recognized in that way and having other immigrants see that, to bring to the forefront the contributions that immigrants make to this nation, I was just so proud to be honored in that way. When I sit on panels or I give off my time, it's because I care. I care about global health. I care about the world that my son and my grandson is going to live in, probably well after I'm gone, and future generations. I care about humanity. To all the nurses out there, thank you, thank you, thank you. I know it's been a traumatic, devastating 2+ years that nothing could have prepared you for. What I saw over and over again were the courage, the resilience, the commitment that you had to your patients and the profession that you chose. I know that burnout and exhaustion is a product of the work that we do as healers. And I also know that sometimes we feel guilty about taking care of ourselves. But I urge you not to be so hard on yourself, not to feel guilty about taking care of yourself. Even healers need healing sometimes.
Nurse Sandra Lindsay is the Director of Patient Care Services for the Division of Critical Care at Long Island Jewish Medical Center, Northwell Health. And on December 14th, 2020, she made history and global impact when she rolled up her sleeve and became known as the first person in the U.S. to receive an FDA-approved COVID-19 vaccine. It's significant that the first person to receive the COVID-19 vaccine in the U.S. was not the president, a philanthropist, pro athlete, or a high-profile celebrity with millions of followers, but a nurse. While not planned, having a nurse, a woman of color, and an immigrant as the first to receive a COVID-19 vaccine has become a significant and powerful message. As Sandra said, she's part of a team that intentionally and actively cultivates diversity and inclusion with the aim of representing and caring for the communities that Northwell Health serves. A nurse who, without specifically preparing, was fully prepared to meet the moment when an unexpected circumstance called on her to lead. Sandra has become an important advocate on the need for vaccinations and led the way in having respectful conversations with those who might be hesitant to roll up their sleeve for the shot and help end the pandemic. In July of 2021, Sandra was presented with the U.S. Citizenship and Immigration Services Outstanding Americans by Choice recognition during a special naturalization ceremony at the White House, and honored for exemplary civic service and her continued public health efforts, an honor that recognizes naturalized citizens who have demonstrated their commitment to the U.S. and to the common civic values that unite us as Americans. At the ceremony, President Biden said, "During the height of the pandemic, Sandra poured her heart and soul into working with patients and keeping her fellow nurses safe. When the time came, she became the first person in America to get fully vaccinated outside the trials. And she's out there making sure patients and folks in the community get vaccinated." Since this recognition, Sandra has become a prominent face and force on the front lines of the country's biggest ever vaccination campaign. She acknowledges the mistrust in communities of color, which stems from past history, and is serving as a trusted source and healthcare professional to help answer their questions, identify the safeguards in place, and point them to the evidence-based information, just as she did before getting her vaccination. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.